Hello, you're welcome to my channel, Dr. Amayi Sports. It's exciting to have you here. Today we'll be continuing our discussion on sepsis. In the last video, we introduced the concept of sepsis. We looked at the criteria and several scoring systems. We also discussed the associated risk factors and common pathogenic organisms that are known to cause sepsis. And then we also looked at sepsis focus. In this video, we shall be discussing the pathophysiology of sepsis. All right. Please, you can refer to the last video if you haven't seen it, so that you'll be able to catch up with the current discussion. Thank you very much. Uh, so, we noted in that video that for sepsis to occur, there has to be two important things. One is that you know there has to be an ongoing infection. Okay, there has to be an infection or an infectious process. And the second is that there has to be clinical evidence of life-threatening organ dysfunction. Okay, now for this infection, all right, it can be demonstrated objectively, or there could be evidence of clinical dysfunction, and this can be got into laboratory studies. Okay, and if this is not available, there could be a suspicion of an ongoing infectious process. Now, this suspicion can be gotten through the process of history taking and physical examination. All right. Now, it is not a prerequisite to have a laboratory evidence of infection to make a diagnosis of sepsis. All right. Merely suspecting a background infection, which this suspicion, as I just mentioned, can be gotten from history, or there could be clinical signs that um, can point toward an ongoing infectious process. Now, if this is present together with any feature of life-threatening organ dysfunction, a diagnosis of sepsis can be made and appropriate treatment can be commenced. All right. Later on during treatment, of course, before commencing treatment, samples would have been taken to be sent to the laboratory. So later on during treatment, this can come up. We say that diagnosing sepsis is a retrospective activity. This is especially true if sample the results from the laboratory studies come out eventually and it shows that indeed there is an infection. But again, recall that in over a third of cases, the actual organism is not isolated, but from commencement of antibiotics, right, the patient gets better, and then that also supports that indeed sepsis may have occurred. Okay. So we note for as we mentioned earlier, for sepsis to occur, there has to be a focus. All right, there has to be a focus for sepsis to occur. Now, this focus, okay, just means there has to be a window, like somewhere through which these microorganisms can gain access into the body. All right, the most common is through lower respiratory tract infection, pneumonia. All right, other very common sepsis focus will be intra-abdominal infections or intra-abdominal malignancies. For example, if we have appendicitis, ruptured a ruptured appendix to cause chemical, cause peritonitis, bacterial peritonitis, and from there to abdominal sepsis and bacteremia and sepsis can occur. Through intestinal obstructions, through gut perforation from any cause. All right, urinary tract infection, which is quite common in the elderly population. All right. So all of these are the focus for sepsis, even skin and soft tissue infections and diabetic foot ulcer, bed sores, or cellulitis, or even other infectious processes like osteomyelitis. All right. Now all of these are focus. These are foci for sepsis. Now the important thing is that irrespective of the focus, the causative organism gains access into the general circulation, into the bloodstream, and begins to cause havoc. All right. Now, sepsis can be caused by various of microorganisms, most commonly bacteria, but can also be caused by viruses, can also be caused by fungi and protozoa. All right. But the most common cause of sepsis is bacteria. So bacteria are the most common cause of sepsis. All right. So we'll now take a closer look at the, the, these bacteria we just mentioned. All right. Um, Bacteria here can be classified using their gram-stain properties, right, into gram-negative bacteria or the gram-positive bacteria. All right, these gram-negative bacteria, they have a very simple cell structure. They have an inner membrane and a very thin, okay, an inner membrane, a very thin layer of peptidoglycan, and an outer membrane. Okay, here is the outer membrane. This outer membrane contains an important protein of interest, that's the lipopolysaccharide. Now, this lipopolysaccharide is an immune trigger. Okay. Now, for gram-negative organisms, for gram-positive organisms, they have something similar to this. They are other their own immune triggers. They have the lipotecoic acid, um, okay, lipotecoic acid, hemolysin, um, and super antigens. Okay, super antigens. Okay, these are immune triggers found in gram positive organisms. Now, super antigens are a special group of antigens, special in that they, unlike other antigens that activate just a limited number of immune cells, super antigens they activate a very large amount, an overwhelming amount of T cells. All right, so this will now lead to the release of overwhelming quantities of cytokines. All right, so this is where they got their name from, super antigen. So they cause the release of very large um, amounts of cytokines to the general circulation. Now, when these cytokines are released into the general circulation, they give rise to fever. All right, they cause vasodilatation. Um, because of vasodilatation and they also increase the porosity, capillary porosity. All right. Okay. So what this does is that, of course, the vasodilatation will reduce the blood pressure, and with this porosity, there is pooling of blood. Blood begins to move out of the intravascular space into the interstitium, and blood begins to pool there. So this reduces the effective circulating volume. All right. So as blood leaves the circulation to the interstitial space and begins to pool there because the porosity of these blood vessels have been increased, you will know that the circulation volume is reduced. Now, this would further decrease blood pressure and to further decrease blood pressure and will also decrease perfusion, tissue perfusion. Okay, also decrease tissue perfusion. Okay, now with this decrease in tissue perfusion, it simply means that the peripheral tissues are not getting adequate blood to meet their metabolic demands. So this is one of the things that can lead to life-threatening organ dysfunction in sepsis. All right, because the kidneys, for example, if they are not well perfused, they're going to AKI, acute kidney injury, and then which can go down the stream and amounts to other renal pathologies. All right. So this is what super antigens do. And there are very common examples of these super antigens. The streptococcal pyrogenic exotoxin, right? Streptococcal pyrogenic exotoxin is one, and staphylococcal endotoxin. All right, and Of course, toxic shock syndrome, toxin. All right. So all of these are common examples of super antigens, and this is how they uh, they complicate sepsis. Right. Now, so whether we are looking at the gram-negative organism or the gram-positive organism, now once these organ gains access into the body, they release their triggers. Triggers can be lipopolysaccharide, as we have just seen here, or if the triggers are not a lipopolysaccharide in gram-positive, if it's a gram-positive organism, like Staphylococcus and Streptococcus, as the case may be, all right, they give rise to any of these triggers, and they will amount to their functions, as we just saw there. Okay, now whatever the case, whether gram-positive or gram-negative organism, now was these triggers, gain access to the circulation. Sorry. Okay, good. Okay. Once these triggers are released into the once the triggers are released into the circulation, all right, they stimulate immune cells. So they stimulate immune cells like macrophages to release pro-inflammatory cytokines. Now, within the first hour, all right, interleukin one and okay. Within the first hour, interleukin-1 and tumor necrosis factor alpha are released. And these are about the first pro-inflammatory cytokines that are released. Now, the functions of interleukin-1 and tumor necrosis factor alpha, the functions are diverse and they are very crucial. They determine the series of other activities that will progress, that will go on along the pathophysiology of sepsis. All right. Um, One of the important functions is that they go on to stimulate the cells of the vascular endothelium. Okay, they stimulate the cells of the vascular endothelium, and when this happens, this triggers the release of tissue factor. Okay, this triggers the release of tissue factor, and tissue factor itself goes on to activate or to cause the release of thrombin. Okay, and thrombin propagates coagulation. It enhances coagulation. Right. Okay. So now this coagulation we're talking about, remember that it's occurring within the circulation. So this is essentially intravascular coagulation. And for as this coagulation uh, goes on, it utilizes platelets and other coagulating proteins. Now this is very important. Okay. Now, it is very important to note this because as coagulation becomes widespread, as intravascular coagulation becomes widespread, the platelets and coagulating proteins become exhausted. All right. So when they become exhausted, they could give rise to this can amount to DIC. Okay. Disseminated intravascular coagulation or yes, disseminated intravascular coagulation. Now, DIC is coming up because essentially the widespread coagulation has exhausted platelets and other coagulation proteins. All right. Now, we'll get back to this shortly. Now, we come back to interleukin one and the tumor necrosis factor. All right. Another function of what they also do is that they impair fibrinolysis, they impair fibrinolysis. Mhm. So they achieve this by activating plasminogen activator, okay, inhibitor one. Okay. So they activate plasminogen activator inhibitor 1, and by doing this, they impair fibrinolysis. And with impaired, you know, with impaired fibrinolysis, of course, more coagulation, right? So there is more coagulation with impaired fibrinolysis. So you see now that the net effect of all of this is that there is widespread increase in um, there is widespread increase in intravascular coagulation. All right. Now, again, there's something that tissue factor here and this plasminogen activator inhibitor. There's something interesting about them again. All right. Aside activating the whole coagulation cascade, as we have just noted, they also cause increase in vascular permeability. All right, because increase in vascular permeability. Okay, so again, what this does, as I just mentioned a few minutes ago, is that it leads to pooling of blood. Okay, okay, all right, and out of the vascular space. All right, out of the vascular space. Okay, so this is where we have pulling of blood out of the vascular space. So as blood leaves the vascular space, all right, it goes along with heat. Okay, because of the swelling. So these are we are now seeing the features of acute inflammation. All right, there's warmth, there's swelling, there's redness. Okay, pain and loss of function because the cytokines also stimulate uh, the somatic and the nerves around the region, and this stimulation causes pain. All right, yeah. So this is what happens. So with this pooling of blood, circulation volume is reduced, and this goes on to reduce blood pressure again, and it goes on to of course further reduce tissue perfusion. Okay, tissue perfusion. So this is very important. So this is one of the pathways, all right, interleukin 1 and tumor necrosis factor. So again, these molecules, these are pro-inflammatory cytokines, interleukin 1 and tumor necrosis factor alpha. They are quite busy along the pathophysiology of the sepsis spectrum. All right, and we're not done with them. So we noted that because they stimulate the vascular and endothelial cells, and they cause the release of tissue factor, and they also impair fibrinolysis. What else is interesting about them? So let's come this way, and we okay. So what else is interesting about these guys? It is important to note that interleukin 1 and tumor necrosis factor alpha. Okay, it's important to note that these molecules they go on to dissociate nuclear factor. Okay, sorry, I should write this better. Nuclear factor kappa B, all right, from its inhibitor. Ab initio, before now, nuclear factor kappa B remains bound to its inhibitor, and this binding renders it inactive. All right, but interleukin 1 and tumor necrosis factor, when they come on board, they dissociate nuclear factor kappa B from its inhibitor, and this liberates active nuclear factor kappa B. All right, nuclear factor kappa B goes on to, initiate messenger RNA, all right, to induce protein synthesis. Okay, they initiate some messenger RNA to induce protein synthesis. All right, now why is this important? Okay, so what proteins exactly are we synthesizing in this instance? Importantly, okay, importantly, the proteins that are synthesized, of your guess is as good as mine, are more, okay, pro-inflammatory cytokines. Yes, more pro-inflammatory cytokines. These are the proteins that are synthesized. Now, new pro-inflammatory cytokines come on board, and we are looking at interleukin 6, um, Okay, interleukin 12, okay, interleukin 6, interleukin 12, and um, interferon gamma, right? Okay, interferon gamma. Yeah. Okay. So this is what happens. All right. So the interleukin one and tumor necrosis factor alpha, they are about the first cytokines that responds to inflammation. They are released within the first hour. So what they do is that they set the stage for sepsis. All right. From promoting coagulation to promoting to inducing permeability, vascular permeability, which leads to pulling of blood away from the vascular space, crashing the blood pressure, bringing down effective circulation volume, reducing tissue perfusion, which will reduce the perfusion, of course, of blood, the perfusion of organs, of end organs, all right, to now stimulate, inducing the activation of nuclear factor kappa B, which goes on to enhance protein synthesis, activate, which goes on to activate a messenger RNA that promotes protein synthesis that make further pro-inflammatory cytokines. Right, so you can see how busy these initial cytokines are. Now, the pro-inflammatory cytokines that have been released just here, interleukin 6, interleukin 12, and interferon gamma. Interleukin 6 here, all right, plays an important role because it causes the release of acute phase reactants, right? Acute phase reactants. All right. Yeah. So that's what interleukin 6 do. Causes the release of acute phase reactants. Now these acute phase reactants released from the liver. All right. They are synthesized. Now these acute phase reactants are produced by the liver. Okay. These acute phase reactions are produced by the liver, and the liver produces acute phase. Of course, acute phase reactants are proteins, right? The liver produces acute phase reactants using amino acids as raw materials. Amino acids, they are building blocks of proteins, all right, and they can be gotten from breaking down, as we see in chronically ill patients. It's breaking down of muscles, all right, and this leads to weight loss or cachexia. Okay, so this muscle mass, large bulks of protein are broken down in case muscle mass, and then breaking down of these gives liberates amino acids, which the liver uses in turn to uh, synthesize acute phase reactants. Now, the release of these acute phase reactants is stimulated by interleukin 6. Now, common acute phase reactants, C-reactive protein, serum amyloid A protein, right? Okay, serum amyloid A protein. Fibrinogen is also an acute phase reactant. Fibrinogen, right? Now, so just here, this is important. All right, this is very important to note this. All right, we would come back to this. All right, so the functions of these acute phase reactants are essentially to our favor. They are good. All right. For example, okay, okay. Now the functions of these acute phase reactants, okay, are important. C-reactive protein, and some of these bacteria that gain access to the body. So we have the bloodstream, and we have these bacteria transported along the bloodstream. Now, some of them are not, the macrophages are unable to identify some of these bacteria. All right. So, because the macrophages are unable to identify them, they go about causing havoc without interference. All right. What C-reactive protein does in this instance, so you will have a bacteria here, all right, not identified by the macrophages. What C-reactive protein does is that um, it's marks, it tags, okay, it binds to the bacteria, it tags the bacteria, right? Now, this tagging all right, makes macrophages to be able to recognize this bacteria in question, all right, and you know this will enable the macrophages to phagocytose the bacteria. Now this whole process is called opsonization. Okay, opsonization. Yeah. So as a result of this, of course, C-reactive protein is said to be an opsoname. Okay. Yeah, C-reactive protein is said to be an opsoname. All right. So this is, of course, fibrinogen coagulation pathway will support coagulation and all that. So these are the very common examples of active phase reactants and what they do. In the short term, they are excuse me, in the short term, their functions are are positive. They are good. They help the body deal with infections. They help the body deal with insults and all of those. All right. Aside from this, they also do. They also cause other important. They also do other important functions like they mop up free radicals. They take care of cellular debris or remnants. All right. Yes. So these are the other. They also activate. Okay, so let's so active phase reactants. This is where we are. All right. So aside opsonization, we just noted that opsonization is one of the functions. They help to mop up free radicals. All right. They mop up free radicals. All right. They also remove debris, cellular debris or remnants. All right. Importantly, they activate the complement system. All right. They activate the complement system. Now, this is important. Um, you know, um, complement proteins C5b, complement proteins and C5b, C6, C7, and C8 and C9. All right. Now, this protein they form what is termed the um, they form what is termed the membrane attack complex. Okay, they form what is known as the membrane attack complex. All right, MAC. All right. So this membrane attack complex, what it does is that it invest itself into the membranes of okay, should draw a better diagram. I'm sorry, I've been some sort of issue with my writing setup. I don't know what's going on. Alright, so we have this bacteria here. Alright, and this is the membrane of the bacteria. So what the MSC does is that it opens a channel, it injects itself along okay, sorry. Okay, yeah. So it injects itself, uh, okay, along the membrane of a bacteria, and this opens a channel, right, for calcium to go into the cell, the bacterial cell in this instance. All right. Now, why is this calcium? Why is it important for calcium to go into the cell? That's because calcium goes in, activates a lot of proteolytic enzymes, right? Activates proteolytic um, enzymes. All right. Now, this will bring about proteolysis. The organelles within the bacteria are destroyed, and of course, this leads to the death of this bacteria. All right. Yeah. So you can see that bacteria. in circulation in the body, bacteria in the body can be killed or taken care of via different mechanisms through phagocytosis by macrophages. Then in instances where the macrophages are able to identify these bacteria, oxygenation comes into play. Importantly, C-reactive protein does this. It tags the bacteria through a process called oxygenation, and this makes it now possible for the macrophages to identify these bacteria and phagocytosis them eventually. And then also the acute phase reactants activate the complement system, and these complement system, complement protein C5b, C6 through C9, they form the membrane attack complex, which opens calcium channels on the membranes of bacteria, right? And then there's influx of calcium ions from the extracellular fluid, and calcium ions goes into activate several proteolytic proteins, and these of course would self-destruct the bacteria, all right, proteolysis to cause the proteolysis of organelles within the bacteria, important organelles that keep these bacteria alive and growing, all right. Of course, would lead to the eventual death of the bacteria. So all of these are very good functions of acute phase reactants. All right, but in the short, but they are not. See, they are acute phase. They are not supposed to be out there for long. So when they are out there for long, they begin to cause havoc. Okay. So far we have been discussing the pathophysiology of sepsis. We started out by noting that two things are crucial for sepsis to occur. These two things, one is that there has to be a background infection, and then of course um, life-threatening organ dysfunction. We know that bacteria are the most common causes of sepsis. So gram-positive or gram-negative bacteria can cause sepsis through the release of triggers that will induce the immune system for response. Now, in sepsis, this response is exaggerated, and it brings about um, in sepsis, this response is exaggerated and brings about life-threatening organ dysfunction. This life-threatening organ dysfunction comes about through different mechanisms. One is through vasodilatation and increased vascular permeability. All right, this will bring down the blood pressure, bring down the circulatory volume, and this will reduce tissue perfusion. And so, enough blood is not getting to the organs. It would, of course, which will lead to organ dysfunction. All right. Also noted that the interleukin one and tumor necrosis factor alpha can also activate they can also impair fibrinolysis. This is done by activating plasminogen activator inhibitor 1. And of course, all of these would go on to support intravascular coagulation, and then this tends the body towards disseminated intravascular coagulation. All right. Now, other functions of the interleukin 1 and tumor necrosis factor noted is that they dissociate from nuclear factor kappa B from its inhibitor, and this goes on to initiate the synthesis of messenger RNA that carries the genetic code for protein synthesis. Now, protein of interest in this instance are more pro-inflammatory cytokines like interleukin 6, interleukin 12, and interferon gamma. Now, these cytokines, of course, the interleukin 6 would go on to cause the release of acute phase reactants. Acute phase reactants are synthesized by the liver using amino acids as raw materials, and the glycerinated protein, serum amyloid A protein, fibrinogen, and as the case may be, C-reactive protein itself is an opsonine that attacks unidentified bacteria, making them visible for phagocytosis. And fibrinogen also supports further fibrinogen supports further um, intravascular coagulation. Also leads to the okay also leads to formation of Rayleigh formation, right? So red blood cells tagging, okay, clumping together. All right, red blood cells forming together, clumping together, right? Rayleigh. formation, right? Now, this here it's why we see that the erythrocyte segmentation rate. This is why erythrocyte segmentation rate is expected to be increased in sepsis. All right. Now, of course, we also noted that aside the release of histamines, they also activate the complement system that form the membrane attack complex C5b, C6 to C9 that open calcium channels on the bacterial membrane for influx of calcium ions, right? And then this goes on to also cause the death of bacteria. We should also note the contributory roles of secondary mediators like thromboxane, like nitric oxides, as the case may be, even platelet activating factor 1. All right, all of these are secondary mediators. They also are contributing to all of these after causes. Okay, so we've listed quite a number of cytokines and yes, we've managed to look at their roles in. We've listed quite a number of cytokines. Okay, we've listed quite a number of cytokines. Now, from this discussion, we should be able to note that their effects are far-reaching. All right, so they have broad effects or far-reaching effects, right? Okay, yeah. So let us explore this. All right. Now, the cytokines themselves, they act on the bone marrows, right? They act on the bone marrows. Okay, um, the bone marrows, right? Now, this brings about the leukocytosis that is seen in sepsis. Alright. Though, however, sometimes the disease process we should quickly note here that sometimes an ongoing disease process can suppress bone marrow, alright, and this would rather give rise to leukopenia. Okay, so this is why in sepsis we leukocytosis or leukopenia can be seen. Alright, leukocytosis here is white cell counts greater than 12,000, right? 12,000 times 10 to the power 6 per liter, or of course leukopenia less than 4,000. All right. Yes, so this is one of the things due to the bone marrow, all right, leukocytosis or leukopenia. All right, and because of overstimulation of this bone marrow, sometimes we on the peripheral thing we begin to see bad cells, and these bad cells can be above 10%, sometimes see more than excuse me, we see more than 10% of bad cells. All right, cytokines, as we just noted, can also cause can also act on the liver, right? They can also act on the liver. All right, the liver induce release of acute phase proteins. Right. Cytokines can also act on the hypothalamus, right? This one now is important. Um, okay, the hypothalamus. Mm. Okay, so let's explore this further. Right, the hypothalamus, that's where the temperature, we have the temperature set point. Right, temperature set point. Now, this temperature set point is like a switch. All right, it is the point, right, where the body decides that this is the normal temperature I want to function and I want to be in. Right. Okay. So we can see. Let's think. We can use a graph. So let's use a graph and see. Right. Okay. So for example, the temperature set point, the body can set its temperature at 37 degrees, right? Celsius, right? 37 degrees Celsius, okay? 37 degrees Celsius. Now, this is the set point. So, once this temperature is set, body mechanisms are activated such that the body temperature is kept at this temperature set point. The body temperature is kept here. So, you stick a thermometer to the axilla or anywhere and you measure this patient's temperature, you get 37 degrees. All right. So, now the cytokines that are released, right, they migrate. The cytokines that are released, they migrate to the hypothalamus, right? So what they do at the hypothalamus is that they increase the temperature set point, all right? They increase the, sorry, we should use black. They increase the temperature set point, okay? So this is what happens, all right? Temperature set point is increased. All right. Now we can take an arbitrary value here. Let's okay. So let's call this 39. All right. So let's call this 39 degrees Celsius. So somewhere is 38. All right. Yeah. So somewhere is 38 degrees Celsius. Right. So the cytokines migrate to the hypothalamus. They increase the temperature set point to 39 degrees Celsius. Okay. So now the body now senses this as the new normal. Right. The body senses this as the new normal. Okay. The body senses this new temperature set point as a new normal. So you can imagine that so you can imagine that the body has been functioning at 37 degrees Celsius. All right. So for example, if during cold weather, when it's raining, cold nights in winter, and all of those, all right, the body temperature drops. All right. So as the body temperature drops, it travels away from the temperature set point. The body realizes that something is wrong. I am getting cold. The body begins to activate mechanisms to increase the core temperature. Now, what are these mechanisms? From behavioral mechanisms, the individual goes on to wear clothes, close the windows, put off his air conditioner, put off the fan, lie down and cover a blanket, drink hot tea, and all of these are behavioral changes, right? This is body initiating mechanisms to help increase the core temperature. Now, other things that the body can do is to cause spasms of the rigors, right? So, let me write this down. All right, the mechanisms. First, we mentioned behavioral changes, and behavioral changes. The next here to note is rigors, right? Okay, rigors. So, okay, sorry, um, okay, okay, rigors. Right. Okay, so these rigors generate heat. So as the skeletal muscles, they begin to go through rigors, they generate heat. And this heat helps to increase the core temperature, and this pushes the core temperature back towards the temperature set point. All right. Other things the body does is that it reduces perfusion, so it causes a peripheral uh, vasoconstriction. Okay, peripheral vasoconstriction. Remember, always note that in blood is heat, so the body distributes heat through blood. So if the blood vessels supplying the skin are constricted, what this means is that less blood gets to the skin, and because less blood gets to the skin, less heat gets to the skin. When heat gets to the skin, heat is lost to the environment through the processes of conduction, convection, radiation. All right, now heat is lost to the environment. So if less blood gets to the skin, less heat gets to the skin, and less heat is lost to the environment. So the body conserves heat. All right, even sweating. All right, sweating is also reduced. Blood supply to the skin or reduces sweating. With reduced sweating, heat loss is also reduced. Now these are some of the mechanisms through which the body uh, tries to bring up this temperature, right? So the body does all of these when this new temperature set point is set. So when cytokines migrate to the hypothalamus, they increase the temperature set point from 37 degrees up to 39 degrees, right? So the body senses this as the new normal and begins to trigger or activate these mechanisms that will begin to, increase the core temperature, and this core temperature will also increase here until it gets to 37 or 30, sorry, until it gets to 39 degrees Celsius, right? So this is the pyrexia we noted earlier when we were discussing SIRS, and in this instance on sepsis. All right, so core temperature greater than 38 degrees Celsius. So this is how it comes about. All right. Now, ideally, it even has a positive effect because in the immune functions, the functions of the immune system, it has been noted they are more optimal or they are more effective in increased temperature. All right, so in pyrexic conditions, immune functions are more effective. All right, so this is what the cytokines do to the hypothalamus. All right, so we'll go back. Remember, we were noting that the cytokines that their functions are far-reaching. They act on the bone marrow, they act on the liver, the hypothalamus, and even the brain. They also act on the brain. All right. Um, their action on the brain gives rise to these altered mental status. What this means is that there may be a decline of GCS, right? Okay. Now, these other mental status is what is captured in the scoring systems for organ dysfunction. All right. Of course, it's a sign that's evidence that other mental status is evidence that there is a brain dysfunction, brain being an organ itself. Right. So it's captured in all of these scoring systems that we discussed in the previous video. All right, especially the SOFA, the sequential organ failure assessment score. Yes. Okay, so this is the pathophysiology of sepsis. All right, this is what happens during sepsis. We have just noted, yes, so it's straightforward, and with this understanding, we can now better grasp the background molecular activities or events that are triggered immediately these microorganisms begin access to the circulation. All right. In the next video, now we have looked at the pathophysiology of sepsis, and in the next video, we will be discussing the management of sepsis. All right. Now, with the understanding of pathophysiology, the management options will now be better understood. And that video will be released within 48 to 72 hours from today. Thank you very much. It is lovely to have you here. Please remember to like this video. Remember to make some comments. Remember to, I will of course be on the comment section to engage you. Remember to share this video, and importantly, please remember to subscribe to my channel. Thanks for coming around. I expect, I'm hoping to see you again next time. Have a nice day.